Well, I appreciate the question, and I always love to be in downstate Illinois. I was there just a week ago, I think. It seems like about a month or two ago, but that's the way time is moving right now, in Murfreesboro, in Springfield, and elsewhere, and in Carbondale. So I'm going to, I am not reticent to travel, and I certainly will try to find a moment in the near future. I would just remind you, though, that as the virus has been so severe in northeastern Illinois and in Chicago and the Collier counties, I've tried to make sure that I've been on hand to make decisions here about the thousands and thousands of people that have been affected here, while also looking seriously at the areas of the state like St. Clair and Madison counties, like Jackson County, Peoria, and Champaign, where there's been a rising number of cases. But I'm glad somebody asked, and I'm always glad to travel, and I will do so sometime in the near future.
The University of Washington projected the COVID-19 apex in Illinois at April 16th and forecasted 2,454 deaths by August. Do those figures and other data in this analysis align with the current state projections?
We have our own statisticians and modelers, along with the scientists and experts here. We have now taken that University of Washington data and melded in some of the conclusions that they reached, looked at the data sets that they had, and tried to make sure that we're doing the right thing in terms of our modeling here in Illinois. We're not concluded. Every day there's new information that goes into these models, but I think that it is fair to say that most of the models that I've seen, and we've seen a number of them, show that we'll be peaking sometime in April in Illinois, and we're not yet close to that. We have weeks to go.
Is it a foregone conclusion that our medical infrastructure will be vastly overwhelmed in a few weeks? What are you going to do about it?
Oh, my goodness. That is my number one concern, is to make sure that we don't have our medical capacity overwhelmed. But I must say, when you look at New York, when you look at other places in the country, and you see how fast the beds are filling, the ICU beds, hospitalizations, and so on, you can't help but feel that, that they too have been running as hard as they can to create capacity and to mitigate and put in orders. Now, I will say that here in Illinois, we not on a date basis, but on a from the time that you saw cases in a state to the time that we put in place our stay-at-home order, we were first, or among the first, to do it. There were earlier cases detected in New York than there were in Illinois, and there was an increase in New York earlier than there was in Illinois. So in terms of the mitigation efforts that we put in place, I am pleased that we were able to be early, or at least to do it as quickly as possible, and that has helped us to drop the number of cases that we think will hit the hospitals going forward. But I must tell you that there's not enough capacity today. That is why you see us building out facilities across the state. That's why you see us putting in triage centers. We're building, our National Guardsmen and others are putting up tents and other facilities at tens of dozens of hospitals across the state to make sure that we're able to keep people separate, so that there's no that the epidemic doesn't fly through an emergency room, for example. And then we're building out capacity at some hospitals to just literally add beds in and onto facilities that already exist. And then McCormick Place and the hospitals that we're looking to turn on in the next couple of weeks.
This will be our last question. Dr. Ezike, if you don't have adequate testing yet, and we're already roughly halfway through the stay-at-home order, then how do we measure the rate of transmission? Do we have any evidence to suggest that the spread is slowing?
Right. So that's a great question. And so in addition to testing, we also have the hospital data. Every day we collect the number of people who are admitted with COVID disease who have COVID-like disease, who maybe haven't had their testing. We're checking the amount of people with these illnesses that require ICU admission, that require the use of a ventilator. And so following those numbers as well, that gives us a track and actual good data in terms of how this is growing and how this is spreading and how our capacity might be reached and how much more we will need. So those data are additional data points that we can use for the modeling that can supplement what we don't have with widespread testing.
Thank
Thank you.
All right, we were hearing a press conference. We'll see you later. Goodbye.